The G-spot is one of the most debated topics in sexual health. Some people describe it as the key to intense pleasure, while others argue that it does not exist at all. This controversy comes from misunderstandings about female anatomy, differences between individuals, limited scientific definitions, and unrealistic expectations created by media and popular culture. In this video, we will explain the G-spot using science, anatomy, and clinical research. By the end, you will understand what the G-spot is, what it is not, and why experiences differ so widely from person to person. Basic female genital anatomy for common people. To understand the G-spot, it is important to first understand basic female genital anatomy. The vagina is a muscular, elastic canal that connects the external genitalia to the cervix. It is designed to stretch, contract, and respond to stimulation. Above the front wall of the vagina lie the bladder and urethra, blood vessels, and nerves. The clitoris is not just a small external structure visible at the surface. In reality, it is a large organ with internal parts that extend along both sides of the vaginal canal. Sexual sensation depends on blood flow, nerve stimulation, and erectile tissue, similar to how male sexual organs function. What is the G-spot? Medical definition. Medically, the G-spot, also known as the Grafenberg spot, is described as a sensitive area located on the anterior or front vaginal wall. It is usually found about 3 to 5 centimeters inside the vagina. Importantly, the G-spot is not a separate organ. It is considered a functional sensitivity zone that may become more noticeable during sexual arousal. Not everyone experiences it in the same way, and some may not feel it at all. Modern imaging and anatomical studies suggest that the G-spot region overlaps with parts of the internal clitoral complex. This includes the clitoral bulbs. This increased blood flow can heighten sensitivity and change how the area feels when touched. Why the G-spot feels different to touch. When arousal increases, the front vaginal wall may feel thicker, spongier, or slightly ridged, while others do not feel anything special. Both responses are normal. Step by step. How to find the G-spot safely. Exploring the G-spot should always involve comfort, consent, and relaxation. A clean finger is gently inserted into the vagina and curved upward toward the belly button using a soft, come here motion. Communication is essential. Pressure, rhythm, and sensitivity vary greatly. If discomfort occurs, stimulation should stop immediately. There is no correct or required method. Role of the G-spot in sexual pleasure. For some women, G-spot stimulation contributes to deep pleasure and intense orgasms. For others, it may produce mild sensation, discomfort, or no pleasure at all. This variation is completely normal and reflects differences in anatomy, nerve sensitivity, and psychological response. G-spot orgasm explained. G-spot orgasms are often described as deeper, fuller, and more body-focused compared to clitoral orgasms. They may involve stronger pelvic muscle contractions and emotional intensity. However, there is no single correct orgasmic experience. Every body responds differently. Female ejaculation and G-spot stimulation. Some women experience fluid release during intense G-spot stimulation. Research suggests this fluid originates from the periurethral glands and is not purely urine. This response is normal for some individuals and does not occur for everyone. Common myths about the G-spot. One major myth is that all women must experience G-spot orgasms to be sexually fulfilled. Another myth is that failing to find the G-spot means something is wrong. Sexual satisfaction does not depend on any single anatomical area. Pleasure is highly individual. Is the G-spot necessary for orgasm? No. The clitoris is the primary organ of female sexual pleasure. Many women achieve orgasm through clitoral stimulation alone. G-spot stimulation is optional, not mandatory. G-spot versus clitoris. Detailed comparison. The clitoris is a complete sexual organ with external and internal components and a very high concentration of nerve endings. Plays a central role in orgasm. Does every woman have a G-spot? Anatomically, all women have the structures associated with the G-spot region. However, sensitivity varies widely. Some women may never find it pleasurable, and that is completely normal. Is the G-spot important for fertility or pregnancy? From a medical perspective, the G-spot has no role in fertility. It does not affect ovulation, sperm movement, fertilization, or implantation. Pleasure and reproduction are separate biological processes. Psychological and relationship factors, comfort, trust, communication, and emotional connection strongly influence sexual response. Pressure to perform or achieve a specific type of orgasm can reduce pleasure and increase anxiety. Medical conditions that may affect G-spot sensation: pelvic floor dysfunction, hormonal changes, childbirth, menopause, and certain surgeries can alter vaginal sensitivity. These changes are common and often treatable. Safety and consent in exploration. Any exploration of sexual anatomy must involve consent. Pain, discomfort, or emotional distress are signals to stop immediately. Final take-home message. The G-spot is best understood as a potential sensitivity zone, not a guaranteed pleasure button. Healthy sexuality is based on education, communication, consent, and respect, not myths or pressure. References: scientific sources, Kamasuruk Br et al., Journal of Sexual Medicine, 2011. Pupo v. Clinical Anatomy, 2014. Levin R.J. Clinical Anatomy, 2011. Mayo Clinic, Female Sexual Health. Cleveland Clinic, G-spot. Does it exist? If you found this video helpful, don't forget to like, subscribe, and hit the bell icon so you never miss an update. We've got plenty more real talk on men's health coming your way. Thanks for watching, and we'll see you in the next video.